Does it look like there's a bloody war zone going on in your pants? And did this start in your 40s? And what I'm talking about today is heavy bleeding, heavy menstrual bleeding with blood clots that started in your 40s. Then check out today's video. You're going to learn more about that, why it might be happening, and what strategies you can take to lessen that bleeding and start feeling better. Hit the bell to be notified when I post new videos every Friday on reclaiming your hormone health and getting off the hormone roller coaster. And please subscribe. I'm Dr. Shelley Meyer. I'm a functional medicine doctor, family medicine doctor, and registered dietitian. In my practice, I help lots of men and women get to the root of their health or of their symptoms and start feeling better. And that involves working with hundreds of women in my past and my present on getting to the root of their hormone problems and getting off the hormone roller coaster and just feeling well and balanced again. So let's talk about heavy bleeding and heavy bleeding with clots after the age of 40. So why is this happening and what is happening? So in your late 40s, like I talk about, or in your early to late 40s, anytime in your 40s, I talk about perimenopause a lot on this channel, and that could be the reason you're having that heavy bleeding with clots, because perimenopause can surge your estrogen, lower your progesterone, and then you kind of have this hormone imbalance that can create heavy bleeding and weird kind of periods that you haven't had before. And a lot of women go through this. Some studies say greater than 80% or more of women in their 40s will have greater than 3 days of heavy menstrual bleeding, and that with clots too. So what's normal? What's heavy? Like I said, more estrogen, then that can cause a thicker uterine lining, and that can cause this heavy bleeding. And that can cause more bleeding and the periods lasting longer. You can also, at this age, have cycles that are anovulatory, meaning you're not ovulating. So then you're not able to shed that uterine lining. So you may feel like you're having a period and maybe really light 1 month, and then you're not shedding that lining. It's building up, and then you have a heavy one the next month, the next month. So normal, what's normal? 2 to 3 tablespoons. Not that any of us are really measuring unless you're wearing a menstrual cup, and that can help. 2 to 3 tablespoons of blood is normal, or average, I should say. There are normal ranges that are above that, and then 3 to 5 days potentially of bleeding. But anywhere between 25 to 80 mLs or milliliters can be considered normal. Now, there are 5 mLs, 5 milliliters in a teaspoon, 15 in a tablespoon, so you can do the math from there. So that's what we consider normal. Now, what's abnormal or heavy bleeding? Oh, one thing I forgot to mention was that normal can be when you go through 2 to 6 pads or tampons in a 24-hour period. And then you can have some clots that can be considered normal. So less than a quarter size clot can be considered normal. But heavy menstrual bleeding is when there's greater than 80 milliliters in a period. But again, if you're not using a menstrual cycle cup, that's kind of irrelevant. Or the more measurable terms, 12 to 16 soaked pads or tampons in a 24-hour period can be considered abnormal and heavy menstrual bleeding. Greater than quarter-sized clots can be considered heavy menstrual bleeding. And then a lot of times in perimenopause, when you're having this type of bleeding, you can have a pink colored kind of spotting that goes along with this, and that can be in between kind of the heavy bleeds that you have. So other causes, if it's not perimenopause, and you do want to talk about heavy menstrual bleeding with your doctor, and the reason I'm saying that is because there could be some more potentially serious causes. So any kind of mass in the uterus. Now, there can be benign masses like what we call fibroids, which are benign tumors basically in the uterus, a benign growth, and that's what a tumor is a growth. Infections. So you want to make sure you rule out any kind of sexually transmitted disease as a potential cause of this. And a lot of times along with the heavy menstrual bleeding, you may have a fever or cramps, but sometimes it'll just be the bleeding. So you do want to get that checked out. Changes in weight. So the more fat you put on, unfortunately, some of us put that extra fat on, particularly around the belly when we're in our perimenopause and menopausal years. And I've definitely suffered from that. It's infuriating because it's like you don't do anything differently and it just happens. But anyway, that extra weight can cause the heavy bleeding. Stress can cause the heavy bleeding, and that's hard to avoid these days. A bleeding disorder. So you do want to rule out if all of a sudden your periods are heavy, or particularly if they've been heavy for a long time, and maybe you were on the birth control pill for a long time and you didn't know they were heavy because it was covering that up, because it kind of fakes out your body a bit, the birth control pill. And a lot of us go on it as teenagers, don't know what our normal cycles are like, come off around our 40s or 30s. We maybe come off to have kids and then we don't go back on. In your 40s, you're off, maybe you're off the birth control pill and then the periods are heavy. And maybe it's not just because you're in your 40s. Maybe you have a bleeding disorder, meaning your blood's too thin, you bleed at the slightest cut. If there's any of that going on or a family history of that, definitely meet with a hematologist to get that checked out. IUDs can make you have heavy bleeding. Blood thinners can make you have heavy bleeding. So if you're on aspirin, a high dose of aspirin for any reason, if you're on particularly blood thinners like Coumadin, Xarelto, forgetting the other prescription ones, but I think if you're on a prescription blood thinner and you're having heavy bleeding, talk to your doctor about it. And then cancer can cause some heavy bleeding, so you do want to get that checked out. Now, so like I said, see a doctor if you're having heavy bleeding. When to see a doctor right away? Well, that would be if you're soaking a pad or tampon, particularly a super, every hour, and it's just not stopping, and it's lasting 2 hours or more. If you're having dizziness, lightheadedness, breathlessness, or fatigue, definitely seek help right away. Other reasons, the clots are greater than quarter sized. If it's lasted, if the periods or the heavy bleeding is lasting more than 2 weeks, particularly, you're going to seek out help earlier if you have those first two signs I talked about. But if it's kind of a constant lower grade bleeding for longer than 2 weeks, you do want to get help with that. If it's after menopause and you're having this bleeding with clots, definitely get seen right away. Or if you're bleeding after sex, that can mean that there's an infection. That can mean that there is maybe a growth there that we want to get checked out. So definitely get some help if this is happening. Then next, we're going to move on to strategies that you can do if you've had it all checked out and it's none of those serious causes that have any other strategies or solutions, then we're going to talk about ways that you can help lower that bleeding or decrease the amount of bleeding. But first, I want you to comment down below if you've dealt with heavy bleeding with clots and what has helped you, so other women don't feel alone, and that's so we can all learn from each other, or ask any questions you might have. So one thing we want to consider when we have heavy menstrual bleeding, particularly in our 40s, because we can be going through perimenopause and having that first few stages of perimenopause, which could include estrogen dominance. And I've talked about that a lot on this channel. I'll link the playlist for estrogen dominance here, and then my channel trailer is the perimenopause information kind of video. But the first few stages of perimenopause can be involving lowering progesterone and rising estrogen, because the body's just trying to hang on to those periods and trying to surge more follicles and trying to get the follicles to kind of wake up in your ovaries so you can have what we call estrogen dominance, and that can cause these heavy periods. So there are things that we can do about estrogen dominance, and I've talked about those, like I said, in the playlist. We can lower our sugar. We can eat an anti-inflammatory diet with lots of fruits and vegetables, lots of fiber, 35 grams of fiber a day. We can filter our water. We can lower alcohol, and we can filter our water to get the toxins out, but lower alcohol to get a toxin out of our lives. Eat more organically if we can afford it. Eat, meat or dairy that doesn't have hormones in it. Stop using cosmetics that have the phthalates and parabens and all that, but definitely see my video where I go through all of these in detail. So you can do that to make your estrogen and your progesterone more balanced. Sometimes having supplemental progesterone, if it is safe for you, can help this problem as well, but definitely get your levels checked. See my PDF about what levels you want to get checked, what levels you're looking for, how to discuss these symptoms with your doctor. There'll be a PDF link where you join my email list and you get access to the PDF down below. And then for the really acute times that this is happening, things that have helped my patients. There's a homeopathic called Sabina, Sabina, and we use it at the 6C dose. And these are little teeny pellets of diluted down minerals or herbs. And you put those 5 pellets under the tongue, and you would use them 2 to 3 times a day, depending on how the bleeding is. Like if using them one time takes care of it, great. You can use it 2 or 3 times a day for a few days to slow down that bleeding. And then you stop it after that, and you don't use it month long, or you don't use it preventatively. You just use it acutely, like I was saying, when you're having the symptoms, when you're having the bleeding. In the stores, a lot of times you can only get in 30C dose, and that's fine to use that too. It's just not going to be as quick. You can order the 6C dose online, and either 6 or 9 is fine, and use it for that. And then you could work with a trained homeopathic provider like myself, who can also get to some other underlying approaches that may help balance things out long term. And then you might not need these treatments every month. Shepherd's purse, I was about to say shepherd's pie. Shepherd's purse is an herb that we use to slow the bleeding down too. And there's a blend I love by a naturopath, Dr. Tori Hetson, called, the brand is called Botanica, and the blend that she has come up with is called Slow Flow. And it's got the shepherd's purse in there, and it's got some other supportive nutrients to help when you're feeling the really bad bleeding, and to help kind of decrease that bleed, or not kind of, it just definitely helps decrease that bleeding. And you use it as needed, not all month long, just like the SIBO. You wouldn't use it all month long. You can use those two together because homeopathics are safe to take with the herbal blends. So I will link those down below, just in a pinch if you need those, you're having these symptoms. But definitely get to your provider, look for estrogen dominance. If you have a homeopathic provider, look for more what we call constitutional kind of medicines, and then discuss any kind of treatments you're trying to take with them, so that we know it's safe for you. Because I am a doctor, but I'm not your doctor, so what I say can't be your medical advice. You really have to discuss it with your healthcare provider, and definitely get evaluated if you are having that heavy bleeding, because it can be so many different things. So join me next week to learn more about getting off the hormone roller coaster and feeling like yourself again. Like, subscribe, and share this video so that I can keep making these videos. And don't forget to grab your free PDF. I also have a webinar called Hormone Balance for Busy Women that you can get the link to down below. And you can join me on my free Mighty Network. It's a private group for women that are wanting to achieve hormone balance, wanting to learn from myself and from each other. And we have monthly live Zoom meetings. We have tips and tricks and encouragement and support. So it's a great, safe space for us to be. So thanks so much for joining me. I'll see you next week.